Did you know that your skin, your nails, your eyes, and even your urine can be sending you urgent messages about the health of your kidneys? Messages most people have no idea how to read? Here's the thing. Up to 90% of people in the early stages of chronic kidney disease have absolutely no idea they have it. None. Because the kidneys are incredibly quiet organs. They can lose up to 70% of their filtering capacity before you feel anything obvious. By the time symptoms show up, the damage is often already significant. And yet, if you know exactly what to look for, your body has been leaving clues the entire time. Today, I'm going to walk you through 17 signs of kidney disease that you can actually see on your skin, your nails, your eyes, your legs, and yes, in your toilet bowl. Some of these will absolutely surprise you. And by the end of this video, you're going to understand your kidneys in a way most people never do. I'm an internal medicine and rheumatology specialist, and I see the consequences of late diagnosed kidney disease every single week. We're talking about patients who thought they were just tired, just a little puffy, just getting older. And by the time they came to see me, their kidney function was already at 20% or 30%. That breaks my heart, because early detection genuinely changes outcomes. So let's get into it. First, a quick anatomy refresher. You have two kidneys. They sit in your lower back, one on each side of your spine, tucked underneath your rib cage like two fist-sized beans. And most people think kidneys are just filters, but they are so much more than that. Yes, they filter your blood, about 180 liters of it every single day, which is roughly 1,500 glasses of water. That's a lot. But they also control your blood pressure, manage your red blood cell production, regulate calcium and phosphate, balance your electrolytes, and activate vitamin D. Think of them less like a coffee filter and more like 5 different organs rolled into 2. So when the kidneys start to fail, the ripple effects show up everywhere. Your skin, your blood, your bones, your heart. Which is exactly why the signs are so varied and why so many people miss them. All right, let's start with the most dramatic signs and work our way toward the subtler ones. Sign 1. Foamy urine. The first sign I want you to know about is foamy urine. Now, a little bit of foam in the toilet is completely normal, just like a little foam forms when you pour water quickly from a height. But what we're talking about here is persistent, thick foam that doesn't disappear after a minute or two. The kind of foam that makes the toilet bowl look like a craft beer. This happens because of a condition called albuminuria, which means protein. Specifically, a protein called albumin is leaking into your urine. Normally, healthy kidneys keep albumin firmly in your bloodstream where it belongs. But when the kidney's filtration units, the tiny, intricate structures called glomeruli, become damaged, they start to leak. Albumin gets through. And here's the clever bit. Albumin has a structure similar to soap. That's literally why it foams. I had a patient, let's call him David, 48 years old, who noticed his urine had been foamy for about 3 months before he mentioned it to me. He thought it was just something he ate, maybe protein shakes. When I tested his urine, his albumin to creatinine ratio was over 300 milligrams per gram. That's stage 3 proteinuria. He had type 2 diabetes we'd been managing, but his kidneys had been quietly under attack the whole time. Within 6 months of starting treatment, his proteinuria dropped by over 50%. If you notice consistent foam in your urine, don't dismiss it. That's your kidneys trying to tell you something. Sign 2. Dark, brown, or cola-colored urine. The next sign you might see, quite literally in the toilet, is dark, brown, or even cola-colored urine. Now, urine color varies a lot. Pale yellow is ideal. Darker yellow just means you're a bit dehydrated. But a reddish, brown, or tea dark color can indicate that red blood cells are leaking through your kidney filters, a condition called hematuria. Healthy glomeruli act like extremely precise sieves. Red blood cells are simply too big to pass through. Think of it like trying to push a tennis ball through a wire mesh fence. It shouldn't go through. But when the mesh is damaged, whether by inflammation, infection, stones, or disease, the red blood cells squeeze through, and they end up in your urine. Now, here's the important caveat. Not all dark urine is kidney disease. Medications like rifampin, certain laxatives, or even eating large amounts of beets can temporarily change your urine color. The difference is that kidney-related hematuria doesn't go away when you change your diet or medication. If you see red, brown, or persistently dark urine with no obvious cause, please see your doctor that same week. Some causes, like bladder cancer, need to be ruled out urgently. Sign 3, pitting edema, the self-test. Now, this one comes with a test you can do right now. Go ahead, I'll wait. Roll up one of your pant legs, and with your thumb, press firmly into the skin over your lower shin bone, that's the bony ridge at the front of your lower leg, and hold the pressure for about 10 seconds. Then release. What do you see? In a healthy leg, the skin will spring right back. But if you see a little pit, a dent, that stays there for several seconds before it slowly fills back in, that's called pitting edema. And that is a sign that fluid is accumulating in your tissues. Before you panic, a small amount of leg swelling at the end of a long day is extremely common and can simply mean you've been on your feet too much or it's warm outside. But significant pitting edema, especially if it's there in the morning or if it's moving up the leg toward the knee and beyond, can be a sign that your kidneys are struggling to clear excess fluid from your body. The kidneys regulate your body's fluid balance. When they start to fail, sodium and water begin to accumulate. They build up in the tissues. The legs and ankles go first because gravity pulls the fluid downward. In severe cases, the fluid can accumulate in the abdomen and even around the lungs. There's also a second mechanism at play. The kidneys help maintain your albumin levels. And as I mentioned, albumin is a critical protein in your blood. One of albumin's jobs is to hold water inside your blood vessels through a process called oncotic pressure. If your kidneys are leaking albumin into the urine, your blood albumin falls, and water leaks out of your vessels and into the surrounding tissues. That's another direct pathway to edema. Periorbital edema, puffy eyes in the morning. Here's one that surprises a lot of people. Waking up with swollen, puffy eyes. Most of us assume puffy eyes in the morning are just from crying, allergies, or a bad night's sleep. And often that's true. But if you consistently wake up with puffiness around both eyes, especially in the early stages of kidney disease, when leg swelling hasn't started yet, it can be a sign that albumin is leaking through your kidneys. The skin around the eyes is some of the thinnest, loosest skin on the body. So fluid that accumulates in your tissues shows up there first, especially when you've been lying flat overnight with gravity no longer helping drain it away. By afternoon, the puffy eyes may have settled, only to return the next morning. I remember a 34-year-old woman, a teacher, who came to me because she'd been diagnosed with severe allergies for almost a year and given multiple rounds of antihistamines. Her eyes were consistently puffy every single morning. A urine dipstick in my office showed 3+ protein. She had nephrotic syndrome, not allergies. Sign 5, pale or yellowish skin. Now let's look at the skin itself. People with advanced kidney disease often develop a distinctly pale, almost grayish or yellowish tinge to their skin. This happens for 2 reasons, and they often happen together. The first is anemia. The kidneys produce a hormone called erythropoietin, EPO, which tells your bone marrow to make red blood cells. When kidney function declines, EPO production drops and red blood cell counts fall. Less hemoglobin means less of the red color in your skin, giving you that washed out, pale appearance. The second reason is the accumulation of pigments called urochromes, waste products that healthy kidneys would normally filter out of the blood. When the kidneys can't keep up, these pigments build up in the skin and give it a yellow or sallow cast. Think of it as the dye in a fabric that wasn't washed out properly. Put the two together, anemia-related pallor plus urochrome deposition, and you get a skin color that experienced physicians recognize immediately. It's hard to describe, but unmistakable once you've seen it. Sign 6, uremic pruritus, that relentless, maddening itch. If I had to pick one symptom that my patients with kidney disease describe as the most torturous, it's this one. Uremic pruritus, a deep, relentless itch that doesn't respond to creams, antihistamines, or scratching. It can be generalized all over the body, or it can concentrate on the back, arms, and face. And it's worse at night, which makes getting any sleep nearly impossible. The itch comes from the buildup of uremic toxins in the skin, waste products that the kidneys are failing to clear. These toxins activate itch receptors in the skin called pruriceptors. On top of that, phosphate accumulates in the blood when kidneys fail, and high phosphate can cause calcium phosphate crystals to deposit in the skin, which triggers further inflammation and itch. It's essentially your skin reacting to being slowly poisoned from the inside. I treated a 57-year-old man, a retired firefighter, whose skin itching was so severe that by the time he came to me, he had literally scratched himself raw. His back and arms were covered in excoriations, open scratch marks, some of them infected. He had been prescribed cortisone cream by 3 different doctors. Nobody had checked his kidney function. When I did, his GFR was 18. That's stage 4 chronic kidney disease. He was close to dialysis. He got started on phosphate binders. His dialysis began, and within 6 weeks, his itch reduced by 80%. He told me it was like being let out of prison. Sign 7, uremic frost. This sign is rare, and I hope you never see it. But if you do, it's a medical emergency. Uremic frost is exactly what it sounds like. A white, crystalline, powdery coating on the skin that looks like frost or fine white powder, almost like talcum powder that was applied and left to dry. It appears most commonly on the face and neck. This happens in the most extreme cases of kidney failure, when the concentration of urea in the blood becomes so high that it literally begins to crystallize out through the sweat glands onto the skin surface. The kidneys at this point have essentially stopped working. Urea, the body's primary nitrogen waste product, has nowhere else to go. I've seen uremic frost twice in my career. Both times, the patient required urgent dialysis. One of them was a 63-year-old man who had missed several dialysis sessions due to a personal crisis in his family. By the time his daughter brought him to the emergency department, there was a fine white film across his forehead and cheeks. His urea was over 60 millimoles per liter. That is a number that can cause seizures, coma, and death. He survived. He started regular dialysis, and within a month, the crystalline deposits were completely gone. If you ever see white powder appearing on someone's skin, especially someone you know has kidney disease, don't wait. Get to the emergency department immediately. Sign 8, Lindsay's nails, half and half nails. Now, let's look at the fingernails. Hold your hands out in front of you. I want you to look at the color distribution on your nails. Normally, the nail should be a uniform pinkish color with a white half-moon shape called the lunula at the base. But in kidney disease, a distinctive pattern can appear called Lindsay's nails, sometimes called half-and-half nails. In Lindsay's nails, the bottom half of the nail near the cuticle turns white or dull, while the top half of the nail toward the tip takes on a reddish-brown or brownish discoloration. The dividing line is sharp and horizontal, almost like someone drew it with a ruler. It affects both hands symmetrically. This sign occurs in somewhere between 20 and 50% of patients with chronic kidney disease, though the exact mechanism is still debated. The leading theory involves increased levels of melanocyte-stimulating hormone, which darkens the distal nail, combined with reduced blood flow to the nail bed, which whitens the proximal portion. Lindsay's nails were first described in 1967 by a nephrologist named Robert Lindsay, which is how they got their name. They're one of those findings that, once you know what to look for, you will spot immediately. And they're a clue worth taking seriously. If you love this kind of information and you want your questions answered in a monthly live stream, then click the link up here to become a channel member. Sign 9, clubbing of the fingernails. Let's stay on the nails for just a moment longer. Here's a test you can try right now. Take both hands and place the backs of your index fingernails together, tip to tip, with the nails pointing away from you. Look at the gap between the nails at the base. Normally, you should see a small diamond-shaped gap, a little window of daylight between the two nail bases. This is called the Shamroth window test, named after cardiologist Leo Shamroth, who used it to diagnose his own condition. If that window disappears, if the nail bases press flush against each other with no gap, that's a sign of nail clubbing. Clubbing means the soft tissue at the fingertip has hypertrophied, enlarged and rounded, causing the nail to curve downward and the fingertip to bulge. It's classically associated with heart and lung disease, but chronic kidney disease can cause clubbing too, particularly in patients who've been on dialysis for many years. The mechanism relates to chronic low oxygen levels and abnormal circulation patterns. In long-standing kidney disease, vascular changes, and chronic anemia both contribute to the environment that allows clubbing to develop. Most people with clubbing develop it so slowly they don't notice, which is why this test matters. Sign 10, calcified arteries, the guitar string sign. This next sign is one of my favorites to teach because of the metaphor. In advanced kidney disease, when phosphate and calcium levels become severely dysregulated, calcium phosphate crystals can deposit inside the walls of blood vessels. This process, called vascular calcification, can affect arteries throughout the body, but it sometimes becomes detectable on the forearms. If you roll up your sleeve and gently press your fingers along the inner forearm, healthy arteries feel soft and slightly bouncy, like a rubber tube. But in a patient with significant vascular calcification, the artery can feel rigid and hard, almost like rolling your fingers over a guitar string or a stiff plastic tube under the skin. This is sometimes called the guitar string sign, and it's an indicator that the cardiovascular system has been significantly affected. Importantly, calcified arteries dramatically increase the risk of heart attack and stroke, which is actually the most common cause of death in patients with chronic kidney disease, not kidney failure itself. Think of it this way. The kidneys are struggling. The phosphate is building up. The calcium phosphate goes into the arteries, and suddenly, you've got pipes that behave less like plumbing and more like concrete. Sign 11, calciphylaxis, when skin starts to die. This is a devastating and painful complication that I must mention because it is catastrophic if missed. Calciphylaxis is a condition where calcium deposits form not just in large arteries, but in the tiny blood vessels that supply the skin itself. When those tiny vessels calcify and block, blood stops reaching the skin in that area. The tissue dies, and it's exquisitely painful. What you see on the skin are dark, purplish, lace-like patches called levato reticularis that progress to painful ulcers and necrotic, essentially dead, black tissue. The pattern is irregular and spreading. It usually starts on the thighs, abdomen, or buttocks, though it can occur anywhere. Calciphylaxis occurs most commonly in dialysis patients and in those with severe hyperparathyroidism, a condition directly caused by long-standing kidney disease. The mortality rate from calciphylaxis is devastating. Some studies report up to 60% in the first year, largely because the open wounds become infected. If you or anyone you know is on dialysis and develops progressive, painful skin lesions that aren't healing, especially with that dark discoloration, please advocate loudly for your care team to evaluate for this condition. Early intervention with sodium thiosulfate, wound care, and phosphate management can make a life or death difference. Sign 12, purpura and easy bruising. Let's talk about bruising. Not the kind from bumping into your coffee table. I mean bruising from minimal trauma, or even appearing without any trauma at all. In kidney disease, a condition called uremic platelet dysfunction can develop. The kidneys normally help clear certain uremic toxins, including guanidinosuccinic acid, which in high concentrations impair the ability of platelets to stick together and form clots. Platelets are the tiny blood cells responsible for stopping bleeding. When they don't work properly, you bleed more easily. What you see on the skin are small, pinpoint red-purple spots called petechiae, or larger bruise-like areas called purpura, which appear without the trauma you'd normally expect to cause a bruise. The forearms and lower legs are common locations. There's also a specific finding called uremic bleeding, where patients with end-stage kidney disease can have nosebleeds, bleeding gums, and prolonged bleeding from even small cuts that would normally clot within seconds. This is also why surgeons and anesthesiologists always check kidney function before surgery. Uremic platelet dysfunction can make any procedure significantly riskier than expected. Sign 13, muscle wasting and loss of muscle mass. Here's a sign that's gradual and easy to attribute to aging or stress. Progressive muscle wasting, particularly visible in the temples, the shoulders, the thighs, and the hands. In chronic kidney disease, a state called protein energy wasting develops. The buildup of uremic toxins directly suppresses appetite. Patients just don't feel like eating. At the same time, the inflammatory environment created by kidney failure accelerates the breakdown of muscle protein. The body begins consuming itself to meet its energy needs. Visually, you might notice hollowing of the temples, where the muscle has thinned. You might notice that the space between the tendons on the back of the hand becomes more pronounced, almost skeletal looking. The shoulders may appear bony, the thighs narrow. In patients on dialysis, the protein wasting can become profound, sometimes called the uremic cachexia. And it matters beyond appearance because loss of muscle mass in kidney disease is directly associated with increased mortality. It's not just an aesthetic change, it's a warning signal. Sign 14, restless legs, the one that steals sleep. Now, for a sign that isn't strictly visible, but that patients describe so vividly that I had to include it. Restless leg syndrome, an irresistible urge to move the legs, especially at night, accompanied by an uncomfortable crawling, creeping, or throbbing sensation, affects up to 30% of dialysis patients. That is a staggeringly high number. The mechanism involves uremic toxin accumulation. iron deficiency, which is common in kidney disease due to both blood loss and reduced erythropoiesis, and dopaminergic dysfunction. The legs seem to develop a will of their own, demanding movement the moment the body tries to rest. I bring this up because I have seen patients who were convinced they had anxiety, fibromyalgia, or a sleep disorder, when what they actually had was kidney disease, presenting primarily as restless leg syndrome. If you or someone you love has restless legs that are unexplained, it is absolutely worth getting a kidney function panel. Sign 15, hypertension, the reading that reveals the damage. This one works in both directions, and it's important to understand why. High blood pressure can kidney disease, but kidney disease also causes high blood pressure. It becomes a vicious cycle. The kidneys regulate blood pressure through a hormone system called the renin-angiotensin-aldosterone system, RAAS for short. When the kidneys detect low blood flow, they activate RAAS to raise blood pressure and push more blood through. In kidney disease, this system gets dysregulated. It fires when it shouldn't. Blood pressure climbs, and high blood pressure damages kidney vessels further. What makes this sign visible is when the blood pressure becomes severe enough to show up in the eyes. During an eye exam, a doctor can look at the blood vessels at the back of the eye, the retinal vessels, and see changes caused by chronic hypertension. Silver wiring, arteriovenous nicking, flame-shaped hemorrhages, even papilledema in extreme cases. This is why every patient with high blood pressure should have their kidney function checked. And every patient with kidney disease should have their blood pressure carefully controlled. The two are inseparable. Sign 16, pallor of the conjunctiva, checking for anemia. Here's a quick test to assess for anemia right now, and this one is kidney-related. Gently pull down your lower eyelid and look at the inner surface, the pink tissue called the conjunctiva. In a well-oxygenated, healthy person, that tissue should be a rich, robust pink. Think of the color of a strawberry or a ripe tomato. If that tissue appears pale, almost salmon-colored, or even white, that's conjunctival pallor, and it's one of the classic bedside signs of anemia. As I mentioned earlier, the kidneys produce EPO, erythropoietin, to drive red blood cell production. In chronic kidney disease, EPO production drops. The body makes fewer red blood cells. Hemoglobin falls. And one of the first places that shows up is the inner lower eyelid. Studies show that conjunctival pallor has a reasonably high specificity for moderate to severe anemia, meaning if you see it, it probably means something. It's not a perfect test, but it takes about 3 seconds and requires nothing more than your fingers and a mirror. Sign 17, the uremic breath, fetor uremicus. And here is our 17th sign. And admittedly, this one you smell rather than see, but it's so distinctive and medically important that I couldn't leave it off the list. Fetor uremicus is the distinctive breath odor that occurs in advanced kidney failure. It has been described as fishy, ammonia-like, or like stale urine. Some patients describe a metallic taste in their mouth alongside it. The smell comes from the breakdown of urea in the saliva. Bacteria in the mouth convert urea, which is highly elevated in kidney failure, into ammonia. It's the same reason that certain fertilizers smell the way they do. It is essentially your body's excess nitrogen waste making its way out through your breath because the kidneys can no longer handle it. Patients themselves often don't notice it because they've adapted. But family members notice, and physicians trained in clinical examination know it immediately. It's one of those findings, like the smell of ketones in diabetic ketoacidosis, that you learn once and never forget. I want to tell you about a case that still stays with me. It was a 71-year-old woman, a former nurse actually, who came to my outpatient clinic accompanied by her daughter. Her name was Margaret. Her daughter had come because she was worried her mother was not herself. Over the prior 6 months, Margaret had been increasingly forgetful, getting dates confused, repeating herself in conversations. She lost over 12 pounds without trying. Her legs were swollen to the knees. Her skin had that characteristic yellow-gray cast. And when I looked at her nails, they were classic half-and-half Lindsay's nails on both hands. She had been told by a previous physician that her memory changes were early dementia. Her weight loss had been attributed to poor appetite in the elderly. When I ran a full metabolic panel, her estimated GFR was 11, stage 5 chronic kidney disease, the edge of kidney failure. Her urea was 42 millimoles per liter. Her phosphate was critically elevated. Her hemoglobin was 74 grams per liter. She was essentially living in a slow-motion toxic state. The cognitive impairment wasn't dementia. It was uremic encephalopathy, a state of confusion caused by the buildup of toxins that the kidneys could no longer clear. Her brain was being poisoned. We urgently arranged dialysis. We treated her anemia with erythropoietin injections and iron. We started phosphate binders. Within 8 weeks of beginning regular dialysis, her cognitive function improved dramatically. Her daughter called my office in tears to tell me that her mother had recognized her grandchildren by name for the first time in months. Margaret is now 73. She's on hemodialysis 3 times per week. She does crossword puzzles. She bakes. She's not fully the woman she was, but she is present. This case taught me, again, that kidney disease is a master impersonator. It wears the face of dementia, of anemia, of allergies, of aging. And if you know what signs to look for on the surface, you can find it before it reaches that level. Causes. So why does kidney disease happen in the first place? By far, the most common causes in the modern world are diabetes mellitus and hypertension. Together, they account for approximately 70% of all end-stage kidney disease cases. High blood glucose, over years and decades, damages the delicate capillaries of the glomeruli, the kidney's filtering units. High blood pressure does the same, but through relentless mechanical stress on those same vessels. Other important causes include glomerulonephritis, inflammation of the filtering units, often autoimmune, polycystic kidney disease, which is genetic, recurrent kidney stones, and certain infections. There's also a group of medications that deserve a specific mention. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, taken regularly over months or years, can constrict the blood vessels that supply the kidneys and cause significant silent damage. I've seen this in patients who are taking ibuprofen every day for back pain and had no idea the cumulative toll it was taking. Diagnosis and treatment. Fortunately, diagnosing kidney disease is straightforward. We use a blood test to measure your serum creatinine, which allows us to calculate your estimated glomerular filtration rate, your eGFR. This number tells us what percentage of your kidney function remains. A urine test checks for protein and blood. In some cases, imaging of the kidneys is done with an ultrasound, and in certain situations, a kidney biopsy is performed to identify the specific cause of damage. The good news is that kidney disease is very manageable, especially when caught early. Treatment depends on the underlying cause. For diabetic kidney disease, tight glucose and blood pressure control can dramatically slow progression. Medications called RAS inhibitors, ACE inhibitors, and ARBs are specifically kidney protective. A newer class of drugs called SGLT2 inhibitors, originally developed for diabetes, have been shown in major clinical trials to dramatically reduce the rate of kidney function decline in both diabetic and non-diabetic kidney disease. For those with more advanced disease, a low-phosphate diet, phosphate binders, erythropoietin injections for anemia, and eventual dialysis or kidney transplant are options that have helped millions of people live full, productive lives. If you have diabetes, high blood pressure, a family history of kidney disease, or you're over 60, please ask your doctor to check your kidney function and your urine. It's 2 tests, it takes 5 minutes, and it could change everything. If you enjoyed this video and you want to learn about the signs of liver disease you can see, because the liver and kidneys are deeply connected and many signs overlap, then I'd recommend watching this video next. And if you've learned something valuable today, share this video with someone who might benefit from it. Maybe someone in your life who has diabetes or high blood pressure, or who's been exhausted and puffy and can't figure out why. You might just be the person who pushes them to get that one blood test. Be sure to subscribe and turn on the notification bell so you don't miss the next one. Stay curious, stay healthy, and I'll see you in the next video. Bye for now.